what you want to do is find out whether there's generally good sensation. So you're going to have the patient close their eyes and you say, I'm going to touch you various places. Let me know whether you feel it and where it is.
Cheek, forehead, arm, other arm, leg, other leg, foot.
Okay. So I have an idea she's got relatively good sensation in the body. The last thing we're going to do is the pulses. So we've got a bunch of them listed here. We've already done a carotid. We do the radial, so you want to compare them, do them simultaneously, and you're feeling for strength. Okay, you're not counting. You don't have to count. You want to check your brachial pulses. And we've got the popliteal. The popliteal behind the knee, they're not easy to find. Sometimes we can pull the Doppler out, but sometimes it's easier to find it with the Doppler first and then find it to palpate it. If you can't feel a pulse, we use Dopplers anyway in the hospital to make sure that there are pulses in the feet in particular. So you do the popliteal. Sometimes you can have a person, if they're really agile, lay on their stomach and do it at that point. But you want to do the posterior tibial. Okay, so the posterior tibial right here, so the right above the ankle. And you want to make sure those are equal. And the dorsalis pedis are on top of the foot. And again, those are kind of hard sometimes to palpate. It may take some feeling around. They tend to be kind of sort of between the big toe and the second toe and about maybe that far down from the toes. If for some reason you had a patient where you didn't feel the dorsalis pedis, then you would probably want to get that checked out, unless you knew that they were difficult. Use a Doppler to make sure it's there. If you had a patient where you couldn't get the popliteal, but you got the dorsalis pedis, well, clearly it's working up here if it's getting down there. So it's not as big a deal. At this point, you're going to say, depending on where you are, you can say you're all done if she was just on the exam table, or you make them comfortable in bed and explain that you were all done and you're going to wash your hands, okay? And you say, is there anything I can get you before I go? And tell them if you're going to be back at a certain time.